Okay, now you start.
Yes. Okay. Okay, sir. Thank you so much. So, good evening, everybody, and welcome to this lecture of ORTC 2024. This is a course by Dr. Ghanshyam Galatia, and so many of you have already attended uh, the courses in previous years where Sir does this every January. He starts this every January, and this time, something new is being done that we are doing a live sessions with Telegram. So myself, Dr. Yamini, and I welcome you to this course and let's start today's lecture. So I hope my screen is visible to everybody. Is it?
Just try to everyone, just try to make the conversation alive. It kind of a discussion rather than dry lecturing. So whenever doctor asks any question, just reply immediately.
Yeah.
Yes, ma'am, the screen is very clear and thank you so much. Good
Thank you.
evening, sir. Good evening, ma'am.
Very good evening, and thank you so much for telling me. So let's, I have named it. The topic is let's explore repertory through cases. So when we learn repertory through cases, we actually understand so many aspects. One is case taking. Second is how to pick up the peculiar symptoms or the most important symptoms and then put it into repertory in form of rubrics and then repertorization. So in whenever I will show you the cases, in all the cases, I'll try to give you step by step, a clarification of how I done it and what was my learning in the case. And then you can also share that whether you liked it or not, what was your learning and what was your question, whatever it is. So let's start first case. So this is a case which is very close to my heart because it was a very bad case of depression. Many years back, I have treated this patient, but I still do follow ups on and off now. I have almost like maybe 5 years of follow up now, 5 to 6 years of follow up. And this is a male patient of 38 years old. When I saw him, he had depression, bad depression, urticaria. There are a lot of other symptoms also, like urticaria on back, which is more on night, and that started only 4 5 months back. Lipomas all over the body. He had big lipomas, big lipomas all over the body, on stomach, on back, and hands, and legs, and thighs, everywhere. Eczema on the right feet, or on dorsal region. He had big patch of eczema. I couldn't find out his photograph. That's why I did not put
1 minute.
clearly.
You goes offline from laptop.
Sir,
Your screen is not available.
the screen is not available. Okay.
Yeah. Actually, that account is not in the group call.
Please share screen again.
Yes. Um, yeah, is it fine now?
Yeah.
Okay. I don't know what happened in between. So sorry for the
Make
interruption.
full screen because screen is small.
Oh, okay. Sir, I have made it bigger. Is it okay now?
No, it's not bigger. Last time it was full screen.
Okay.
Now screen is off.
Okay, I'm trying. Is it okay,
Yes.
sir?
Yeah, okay, perfect.
Okay. So he had a big eczematous patch, very dry on the right feet, and left foot also, a little patch on the left foot. It was not very itchy, but mild itching was there, and knees also. So there were, almost like 4 5 patches of eczema. He had fatty liver and colitis almost 5 6 years back. Warts, many soft and both types of hard and soft warts on neck and back from 1 to 2 years. Warts and eczema came after homeopathic treatment. So I'll tell you, this patient is also a homeopathic doctor, and he took a lot of homeopathic treatment from other doctors. Stiffness in the body in morning, depression. And the main symptom of his depression was that he was not able to wake up in the morning. He was very lazy, very lethargic, and he said that, Doctor, I cannot wake up in the morning, and this spoils my whole day. Because he's a very organized, you will see in the case, he's a very organized person. He wants to do a lot, but he's not able to do. So then he said that after eating also I feel depressed. Whenever I eat my meals, I will be depressed. In daytime I feel dull, and in evening he feels little better. I was a novelist, so he wrote novels, he was a writer, he was a poet in school time. I have lost the ability to write poems. All the time I feel depressed. I was very sensitive, but now I don't get affected by things, he said, from 5 6 months. So we'll explore what happened. I don't feel happy from inside. I can't tolerate hunger. After eating, I become indolent. So after eating, he's very, 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 very dull, and this really bothers him. I just feel like sleeping, okay, all the time, especially after eating. Sour, heavy food, milk, sweets produces sleep. So whenever I have anything khatta, sour, heavy food, milk, sweets, then I will feel sleepy. If I wake up early around 7, I get epigastric pain. So whenever he wakes up early, he would have this epigastric pain, salivation, some sort of acidity. And if I press the abdomen, it becomes better. So if he presses gentle, it becomes little better. Another symptom which is very prominent in this case, which you will see through and through, is sleeplessness in the night. He was not able to sleep at all. Then I asked him, because he narrated the major symptoms. And then I asked him, what is the most bothersome thing for you? What is troubling you the most? He said, I'm not able to wake up in the morning. This is the most important thing. Energy is not there. Depression, I feel. Only evenings, I feel okay. Even when I was young, my bhabhi used to lift me up and brush my teeth. So as a child also, he was not able to wake up early. And now it's a great problem. I mean, it takes hours to make up his mind that okay, utna hai, and he has to wake up and rise and go for the work. So he said it is my very old problem, but it was not that prominent earlier. Itching in the thighs is also very old. I feel very bad in the morning. I feel like lying down. It is from 15 to 16 years. This is not a depression of 1 month, 2 months, or 1 year or two. It's like 15 to 16 years he's into this state. I was in 10th standard. Since then, I got first rank only. So, he was very good in studies. Then he says, I have leadership qualities. There was one teacher in our class, and he really liked this teacher. He said, I started loving this madam. I was very fond of my teacher because during that time, she used to give me a lot of importance. So it was a teenage love sort of thing. And then what happened is suddenly she got engaged. And I felt very bad. This happened in 11th class. And imagine now he's a doctor practicing, having the whole family and doing very well. Still, he remembers this incident. So I said, tell me about it. And he said, suddenly she got engaged and I felt really bad. I felt she cheated upon me. I stopped going to class then. Someone counseled me. I was so upset that my rank also dropped down. So because of this, he stopped going to class. His rank reduced, his percentage reduced, his performance reduced. She said in exam I got only 59%, while I was, in the category of 90 95 earlier. I get attached to anyone easily. I'm a very loving person, but I always feel people will betray me. छोड़ के चले जाएंगे. Then I came to Indore. Earlier, I was very sharp in studies, but now I don't feel so. And the most important thing is I can't do poems now. Only in the evening I feel good to do something, but what to do then? I have many plans, but something is hampering me. Whatever I think I want to achieve, I just don't have that much of physical energy to do things. My capability is reducing. I can't lie to people. Can you tell me? So I said, he said, I have leadership qualities. And then he said, my capability is reducing. I want to achieve. I don't have physical energy. I said, tell me about leadership a bit. Because for me, it was a important thing. So he said, 100 to 200 people used to follow me in school and college. 200 log piche the mere. I went to ministers and all and made it a center. So his place where he lives, it's a small village, but he did a lot of things. He made center, he fought for other people, he went to ministers as a young person also. And he keeps doing it. If someone says, I have this problem, I just want to solve it. So if anybody comes to me with a problem, I have to give the solution.
Again, screen goes off.
Okay. Yeah, is it good?
Yeah, good.
So then he said, अगर कोई आता है मेरे पास problem लेके, if someone comes to me and says that I have a problem, I just want to solve it. I feel it is my responsibility. I had huge financial losses, but I never mind about that. I feel this is my duty to help people, so I keep helping. This doesn't matter that loss ho gaya, anything happened, that is okay. Then I inquired about fears. He said, if a family member is sick, I used to feel very tense. This is my fear. My one child died before this, so he has a boy of child of almost 10 years, 9, 10 years. Then he said, one child before this died, and I have given many medicines to him. He was 8 years old. So that loss I couldn't deal with. But slowly I consoled myself. So he lost one of his child. During depression, I used to feel ghabrahat, anxiety, confidence was low, palpitations used to happen. Also, then he said, doctor, I was the eldest child in my home. So since my childhood, I was taking care of everyone. I was very responsible person. I have to do things for others. And when I lost my own kid, I felt that I failed in fulfilling my duty. I just failed it. I was a doctor, but I couldn't save my own kid. If someone is sitting in front of me, I won't eat anything. This is not my cup of tea. मैं नहीं खा सकता किसी के सामने. I feel hesitant of eating. I have to feed them first. I feel that I should give them first and then I can eat. Then I inquired about dreams. Then he said three types of dreams I get. One is I have given money to someone and I have forgotten. Then I'm doing the exam preparation, but I missed the exam. And I was super confident person earlier, always leading people. But now I feel that I have lost the confidence to face the people. So he is basically from last 10, 15 years, he is not facing people. He's not going into social gatherings. And even if he does, the frequency is very less. He doesn't feel confident about it. And then he said, I was a studious person, but I don't feel I'm the same now. Then he told me about his craving aversions. He said, I have aversion to sour and sweet. I don't like them. But I crave salt a lot. So he loves salty things. And he's a very spiritual person. So he spoke almost like for half an hour about Osho and, Brahma Kumaris. And he said, I was in the ashram. Deep samadhi, he does meditation every day. He used to. Now he does it, but for a less time. So he said, I don't have that concentration, but I like doing meditation. So he said, one day, I felt deep samadhi. It was just quiet and I really felt good. I do meditation every day for 1 hour at least. Okay. So this is the case, more or less. So you can see in the whole case, the most important thing which I could understand is that, repeatedly he says that I have lost the ability. I cannot do this. I am not able to do this. So whenever there are issues of ability, capability, or energy levels going down, and if the patient is worried about it, it is mostly a mineral kingdom. Okay, because the mineral feels the losses or lack of something very, very prominently. So you can see that, after the whole case, I understood that the issue of capability or ability to do something, either it is increased or reduced, both ways. So issue of capability is the main issue in the case. Then he talks about self. Did you see any comparison? Did he say that, they did this to me, or he did this to me, or even when he was, his madam got engaged to somebody, he didn't say that, I will do something about this madam. How could she does this, or how could she do that? No, he said, I was, I was just sad. I was hurt. So we don't see any comparison. We don't see a other person in the case. Whenever he's narrating, though he's talking about a kid, death of a kid, he's talking about a family, health, himself, but he's talking about himself more. So minerals talk about themselves more, and it's more like introspecting that what went wrong. It's not about others, it's about themselves. And it is also not a plant issue because, of course, he's sensitive, but he's not sensitive to almost every impression, which is the plant quality. So no sensitivity and reactivity is there. Am I am I clear? Are you getting my point?
Yes, madam.
So that's why this is very important to understand step by step that why we chose mineral kingdom. So mineral because ability issue, because lacking and losses there. Then also he talks about self, very introspecting person, and no comparison, jealousy, and competitiveness, and no sensitivity issues. So basically, it is a mineral case. And also, very, very important, he talks about relationships. Relationships are very important for the minerals because they create bonds. Their whole survival depends upon their bond with somebody else. Okay, so anion and cations, we know. If they don't form a bond, their valency is not complete. And if their valency is not complete, okay, then they are dissatisfied. And this bond in human understanding, or in terms of humans, you understand that what is our valency now when we get satisfied, when we are connected with somebody. So when we form connections, relationships. So relationships are very, very important for the minerals, and they always, their whole case, their life revolves around the relationship. Either they are, different issues of relationship. So that we saw through and through. So here the main issue of the case is depression, not able to perform his tasks. He's not able to wake up. He's not able to do whatever he wants to do. He's not able to achieve what he wants to achieve. Then there is a skin problem for sure. And he has gastric issues also. Okay, so these are three major issues which a patient has. So I have this habit of writing a case statement or a problem statement at the end of the case. Whenever I do cases, this is my habit. One of my teacher told me to do this, that you have to write down one statement where you summarizes the case, and ask yourself that I need this sort of remedy or these many things in my remedy, and then you are good to go. So this is kind of short analysis of what we want in our remedy. So I have written this. We need a remedy which is a, or who is a main remedy for depression, because that is a chief complaint. You cannot miss that. Second, who takes care of people as a leader. What he said, I have a leadership qualities. He said, koi aata hai mere paas, I have to help him. I don't think he had huge financial losses. Almost say, uh, I asked him, and he said, I have 3-4 losses in lifetime. And he's only, when I took the case, he was 38. So he had almost loss of 70 to 80 lakh rupees, which he recovered. And then he said, it's because of people, because they asked me to help, I helped. So he has this ability to lead people, and he's very compassionate also. So we need a compassionate remedy. So we need a remedy where love disappointment or relationship issues are very prominent. because he was disappointed in love at the class 11th and still remembers it. That means that was important to him. A remedy which has religious or spiritual orientation, because a person who's depressed still doing meditation every 1 hour or going to different ashrams and understanding the whole philosophy is not a common thing, and which has evening amelioration with skin problems. Did I miss anything?
No, you have covered all the main symptoms of the patient.
Yeah. So if you write down this sort of statement, you will see, when you select the remedy, you can just, tick mark that, okay, it is covering this, and this sort of person he is. So this gives you confidence that, okay, your problem statement is equal to the right remedy or the right solution. Okay. So let's go to repertory because we cannot miss repertory, even if I know.
Desire for salt must be added.
Okay. So it must solve desire for, right? That is
Yes,
what
ma'am.
you're saying? Yes, you're right. So I missed the salt desire for because that is very strong. You're right. Okay. So let's go to repertory and let's check the major and most important totality which we have taken, whether it covers, what it gives us exactly. So let's go to repertory. I just want to tell you that um, even if you know even if you feel like that this is the remedy or you know the remedy, it's not bad to check in the repertory. If you go to a repertory and just check it, or so this will increase your practice to use repertory. Secondly, this can also lead to unprejudiced, unprejudiced prescriptions, because sometimes we just think that we know the remedy very well, but you lead to something else through repertory. So repertory really helps, but I'm not saying only rely on repertory. Smart use of repertory is very, very important. You need to understand that don't look at the rubrics given in the repertory. If everything is covered by one remedy, just give it. It's not mechanical. You have to understand that, okay, this is the thread in my case, and if this is covered by that remedy which is given by repertory, then I go to materia medica, check, and then prescribe. So this is the process. Okay. So see, first thing which he told is that I don't have confidence, doctor. I can't meet people. Earlier I was a leader. I have leadership qualities. So I took confidence, want of self, which is a big rubric, has 269 remedies, but very apt rubric, I feel. Then he had love disappointment. And which remedy we think about when we say love disappointment? Disappointed in love?
Ignition.
Ignitia. Anything else?
Natramure.
Natramure.
Yes.
Natrum.
Yes. So mainly we always think about Natramure, but if you can see, it has 85 remedies. Incomplete. I am using 2013 edition. So that's why I said, it's not bad to check in the repertory. It's always good because we never know that love disappointment will have 85 remedies and it can be anything. Okay, so mind, love, disappointment, unhappy elements from aggravation. This is the full rubric. Then he said, I feel that now I'm not able to do this. Now I'll fail. So I took this rubric: delusion, imagination, fail, everything will. So he feels that, everything will fail. Whatever he does, he won't get success. Then he's very sensitive. You saw, he never um, expressed his love to this teacher, but he was very sensitive. He got affected by, that, oh, teacher ka engagement ho gaya. How can this happen to me? Also, he told me some other incidences in his life where he cried a lot. So that's why I took this rubric: sensitive, oversensitive to all impressions. Very sensitive. It also has 600 plus remedies, so big one. Then he constantly thinks what will happen. Did you see in the case? He said, Abhi kaise hoga? I will lose my capability. How will I do this? this constant thinking about what will happen next, or if this happens, what will happen. This is called as anticipation. So anticipation elements from, okay. Then, like one doctor said, that salt desires for. So I took that food and drink salt, and salty food desires for. And then he said, I'm worried about my family's health, so anxiety about family. But this I still consider is not a very important rubric because it was not very well elaborated. But I took it; it was there, and it is also a common rubric. I'll tell you, anxiety about family. Then he said, morning mein we cannot wake up, so he's very lethargic, and we can take this rubric lassitude in morning or weariness in morning. Okay, lassitude is a smaller one, that's why I took this. Then did you see, he said, I have suffered losses. And whenever somebody comes and tells me that he has a problem, I have to act immediately. This is very sympathetic. So sympathetic, compassionate, too sympathetic. He would do anything. He would take 50 lakhs loan for somebody else, but he would help. This is very sympathetic. Then urticaria, because he, described urticaria was there from 4-5 months. I took skin eruptions, urticaria. And he had lipomas. So I didn't want to miss. So I took tumors, lipomas all over. So tell me, this is our repertory chart. Which remedy do you think will come up? Any suggestions? Or which remedy do you think we should prescribe?
Ma'am, causticum we can think of.
Yeah, causticum we can think of. But why?
Ma'am, leadership qualities.
Okay.
Mainly. Highly responsible persons they are. And it also has fear of action on skin too. Along with nervous system, it also have on skin.
Yes, yes, that's true. And also it is very sympathetic remedy.
Natrum group.
Yes, doctor.
Madam, natrum group. Natrum group.
Natrum group. Yes.
Because you feel disappointment.
Yes.
Not natrum, natrum with combination of another one. Sorry.
Okay.
Natrum group.
Yeah, it's a great suggestion. That natrum group with some other, some salt of natrum maybe.
Some salt of natrum.
Yes. Great. Any other?
Hello, ma'am.
Yes.
Evening. Ma'am, mainly 5 rubrics. Ailment from love, disappointed. And in reason he has neglected his duty. And he also has fear of being neglected himself. जो उसका हिस्ट्री पहले का एंड उसका जो बच्चा मतलब उसका जो डेथ हुआ है he is reproaching himself and sadness in the morning and the description of the case also tells that this person is very much responsible with leadership quality and he is a person of great reliability also. So as a person we can go for Aurum. Telecom or Aurum self. Yes, ma'am.
Yes. Absolutely. Great suggestion. You're absolutely correct that he has reproach. He has this guilt of not being able to help his own kid. And delusion, he has neglected his duty. He said this also, that, I'm a doctor and I couldn't help him. So yes, that is also a great suggestion. Thank you. So let's see what, what my repertory chart gave me. Okay. So can you see? So I have taken all these rubrics and you can see the remedy which covers most of the rubrics is lachesis. Though I did not give it because it is not mineral kingdom. Then there is Aurum. Like Dr. Purnima said, that as a person, he looks like Aurum because he's very reliable, responsible. He takes responsibility. He has this guilt. And Aurum has strong religious affection also. They are very religious or spiritual people and understand things. Leadership quality. Gold is a leader. Okay. So Aurum I got, and it is covering 9 rubrics. And then if you look at the first one, that is Aurum mur natronatum. Okay, so it's not only Aurum, it's a salt of natrum, mur and Aurum. And unfortunately, we don't have much reliable materia medicas which tells us about aurum mur natrionatum. It's a small remedy. But if you understand aurum and natrum mur, you will understand that this looks a great combination for this person, because he is a leader, he is very responsible, he has the guilt, he had this love disappointment, and most importantly, the physical symptom which is covering natrum mur partus, this salt desire for and this dry eczema, itchiness, aggravation in the night, all these symptoms are there. So that's why I chose aurum mur natrionatum, which was covering many symptoms except one or two, but they were not very important because they are all clinical symptoms, like lipoma. That is okay. So that's why I gave aurum mur natrionatum, and I'll tell you why. So I just want to show you a little bit about aurum, which is written by Dr. Shankaran. And this is a situational materia medica where Shankaran describes aurum as a person. So let's read. So aurum is a syphilitic remedy, one of the heavy metals of the 6th period. We will also talk about 6th row. In aurum, the feeling is that the person must perform tasks which are impossible or much beyond his capacity. He demands of himself industry, responsibility, conscientiousness, and duty of the highest degree. Uncompromising principles or goals that are beyond possible. So what he wants to achieve is beyond possible. This is same with carcinosin, superhuman effort. Okay, but carcinosin has a lot of other symptoms as well. He almost destroys himself in trying to achieve these goals. Would you take loan of 50 to 70 lakh just to help somebody else? Is it logical? Tell me.
No.
That means somebody is destroying himself. So this is the this is the crux, that he destroys himself to achieve the goal, because if he does not achieve them, he gets the feeling of failure, guilt, and despair of salvation. He said, I don't mind losing money, but I mind, not being able to help people. That is important for me. It is as if his survival depended on his ability to take on these huge responsibilities. So since childhood, he was the only member. He was the eldest child. He had to take up the responsibility of others, and he was so good at it. Okay. So, below, if you read Soul of Remedies, you will see that Dr. Shankaran has also written that they are mostly, people at a very high position in the family, in the society, etc. And then if we talk about natrum mur, you all know natrum mur very well. What we know about natrum mur? One is love disappointment. Okay. And in this case, you also see a little bit color of teenage love, or though he's very responsible, but at the same time, this hurt which this broken relationship has given him is very important for him. So this is very uncommon, okay? Because aurum as a person doesn't get affected so easily. But natrum mur as a person, because when you see the development chart, natrum mur is a alkali metal. Natrum is an alkali metal. And it creates bond, and that's why it gets affected by small things, because it is in 3rd row and aurum is in 6th row. So that's why we cannot give aurum metallicum. And in these type of cases, actually it tells you that though aurum metallicum, if we go to repertory, we'll check. See, aurum is covering most of the rubrics. I mean, one more rubric than aurum mur natrionatum, but still we did not choose aurum metallicum because it doesn't cover, absolutely everything. And we don't get the whole picture of aurum metallicum, which is very, tough guy and robust personality, and not a person like who cries on every other day. So that's why not aurum met, but aurum mur natrionatum. I hope you're getting my point. Yeah?
Yes, ma'am.
Yes, ma'am. Yes, doctor, it's clear.
So what we know about natrum mur is this desire for salt. We know salty remedy, salty khud. Very sensitive. Relationships are very important issue. And then if we see what he said, that I felt in one sentence he says that the madam got engaged to somebody else and I felt cheated. I said, I felt that लोग मेरे को cheat ही करते हैं. People are cheating on me. So the sense of betrayal is very, very strong in all the salts. Wherever halogen is there, the sense of betrayal you will see. So again, Dr. Shankaran's book, he says the betrayal that she feels is a betrayal of her trust or faith because the teacher was giving importance to me. अब नहीं दे रही. Okay. She has the fear of being emotionally hurt or disappointed and hence is reserved and unapproachable. So क्यों है unapproachable अभी? Because I don't want to get hurt. This is the main feeling of natrum mure. So I gave aurum mure natrinatum 1 1 dose every week. And I'll tell you why I chose aurum only. I don't have that other chart where I have limited my chart to only 6th row. But I'll tell you if you read about minerals, there are 6 rows and in fact 7, but 7th is like we don't talk much about it. It is a rare ones. 6 rows and 18 columns in the Mendeleev's periodic table. And every row has a theme. Okay. So in the 6th row, you will see duty boundness, responsibility, giving others, doing for others. So mainly all these remedies are very, very duty bound remedies. And the signature remedy of the 6th row is aurum met or any salt of aurum, I would say. And aurum is in 11th column where they are extremely responsible towards society. But after 10th, no, the capacity decreases. Here the problem is I'm not able to wake up in the morning. So capability is reducing. And this reducing capability is a problem for them. This really bothers them. That's why we chose 6th row. And doctor, you were saying causticum. So yes, I do agree that causticum is also a responsible remedy. Causticum is also a very sympathetic remedy. But what is the difference between responsibility of 4th row? Causticum is a kali salt. And 6th row. So in 4th row, if you see the responsibility, that is mostly towards close relationship. Only their family, their friends, spouse, kids, that's all. But not for others. So here the spectrum increases like, huge. And they are responsible towards, these are all change maker people. They want to do for our planet Earth. They want to do for country. They want to do for their society, their caste, religion, and whatnot. So this is the basic difference between 4th row and 6th row. Both are responsible, but 4th row looks for stability, security, and safety. And 6th row remedies look for, giving to the society. So, you will see the difference between them is that one person who's head of the family and he's taking care of the family with so much of love and care. That could be 4th row, but a person who's taking care of the whole village, like, or the whole country or people who are into army or something, they are of, 6th row. Just to make it clear. So that's why not causticum, because causticum, I cannot show you the chart ahead of this. So causticum also covers a lot of rubrics. That's why I said no mechanical use of repertory. Because if causticum comes first, don't give it, just check first. So I gave 1 dose every week because it was a very chronic case and I felt that, 1 is needed every week. Then this is a follow-up after maybe 2 months, almost 2 months. So he did not tell me in the first case that he had the nerve pain on the right side. When he came back, he said, that my shoulder may be pain tha, my hand was paining. It is 25% better, doctor. In morning, I can eat breakfast. Earlier, he said, I cannot eat anything. If I eat, I feel so dull. So he stopped eating actually because of the depression and dullness. He said, in morning, I can eat breakfast. I feel okay. But with whole meal, I still feel, dull. So I avoid taking that. In morning, I'm able to work now. Earlier, I was extremely lazy. Now that feeling is much less. Then he said 2 of my warts are vanished, remaining are there. So 2 of his neck warts were actually, they fell down. Eczema is much, much better. The patch, when I saw this after 2 months, I cannot tell you how beautifully it was reduced. I do have the photographs, but I couldn't find that out. That's why I'm not showing here. So no itching and spot is also reduced, though he had very less itching earlier also. Depression is not there, much better. So this is after 2 months. Then he did not tell me he had diabetes. So he had diabetes when he consulted me. After the medicine, sugar was also under control. Earlier it was not. It was little on the higher side. Then he said, I would walk a lot. Now I am able to walk. Cervical pain he had, that is much better, but he was doing physiotherapy as well. After 6 months, I'm showing the longer follow-up. Sleep better than, because he had a lot of sleeplessness wala problem, better than before. Emotionally, he said, I'm strong. And he said, मैं पहले बात पे रोता था. I didn't have control over my crying. And I was very, very sympathetic towards people. बहुत दया आ जाती थी मुझे. So that is under control. Gums were swollen, but they are not now. Sugar, he said, it's around 180 after meals. Fasting, it is 160 around. I said, it is thoda zyada. And he said, no, earlier it was 250 post meal. So for me, this is a very good change. And he's not on any allopathic medication, I'll tell you. He did not, because he himself is a doctor. So he didn't start. Then he said, when he came to me after 6 months, he started his own cow farm. So he has the huge land. He started this cow farm and started doing organic farming. And he said, now 5,000 farmers are working with me. He's teaching them how to do organic farm. I have built a farmhouse or center where people come and we do small seminars to educate people about organic farming. So this is the difference between 4th row and 6th row. That they want to achieve huge goals, want to do something really big for the society. Okay, so this was a autoimmune NAT case. Is it clear? Should we go ahead for the case 2?
Yes, ma'am.
Yes, doctor.
Okay. So let's go to case 2. This is a simple one. So this is a 35-year-old male, Mr. SP. He came to me with a complaint of pain in the right side of the abdomen, which was radiating to back. And he had back pain, immense pain in the right side of renal area, whole renal region was painful, and some difficulty in urination. So pain in the right hypochondrium extending to back region. And from last 4-5 days, he had bad pain, but this pain is there from almost last 2 months. He said, pain tha, 2 months se tha, but the intensity is too much from last 4-5 months. So he was just ignoring for last 2 months and then he came to me. But I thought it is because of the gas, so I didn't bother because I have a lot of gas ka issue. But from 3-4 days, it is unbearable. Clearly, it is a renal stone. Pain is happening too much. I also have blood in the urine, some discomfort, extreme desire to urinate when I lie down in the night. So whenever he is lying down in the night, he has to go to urinate frequently. I could see that the patient was very restless with the pain. He was extremely restless. He had bad pain in the right side of back, abdomen. Then urgent desire to urinate while he lies down, traces of blood. And then I suggested him to do the sonography. So in sonography, we saw that in the right ureter, he had 13 calculus. Urine stream is also not very strong. It's weak and slow. He feels unsatisfactory after voiding, as if it is not complete. Severe pain in the right side of the kidney along with urethra. And he said, whenever I go to pass urine in the night, only few drops will come. And I always feel that, it's not completely emptied. It dribbles. It comes and then stops and comes. And I always have the sensation that, there's a little bit of urine remaining inside. And it's a quantity is very less in the night. But I have to go because of this constant undone sensation. I asked about the nature. So he said, I'm a very irritable person. I get angry easily. And in anger, I can do anything. I can throw things. Also, I have a lot of anxiety about this disease, that how I will recover, what I will do, what will happen to me. I worry a lot about my business. And he's a businessman. So he loves doing business. He said, I'm a farmer and also owns a retail shop where we sell farming tools. Okay. So he has a shop in the in the suburb area, and he sell farming tools. People say I'm very good at my work. Also, I have tension about future. I want to expand things. I want to open up new stores, my business and work. But this problem has come now. What to do? अभी ये इसको झेलूं मैं. This was his problem. I asked more about himself. He said, I have frequent urination and some blood, and some red particles are there in the urine. I have intolerable pain on the right side and back, but sometimes left renal area also pain. So in these last 2 months, when he came to me, there was a little bit of pain in the left side as well. As I'm a farmer, I have to do a lot of physical exertion in my farms. Initially, I thought it is a backache, but now it's too much. I was tolerating pain thinking that this is general backache, but later I realized that I feel pain during urination also, and I have to go to bathroom frequently. Pain occurs and then I go for the urine, and for some time, like very little time, I get some relief. So whenever he's passing urine, he gets little bit of relief, okay? For very less time, but he gets that. But pain is too much. So I asked, आपको पास करने से पक्का अच्छा लगता है? So he said, yes, but for very little time. And I have backache. I mean, generally also my back pains in between, like once or twice in a month. I have constipation also, but generally I don't feel it. Whenever I'm traveling outside, or if I have gone to my relative's place, to my sister or someone in family, I am more constipated. So whenever he's traveling, he's going to a relative or anywhere, he will have the constipation. At home is fine. In my house, I feel more comfortable. Outside, I get constipated. So in home, he's fine. And there is a gas problem also. It's a very old problem. I feel gases settling in my stomach, especially after lunch. My abdomen just bloats, a lot of bloating. But please treat my stone. So he was just fed up with my questions, and he said, please treat my stones, do something. All these problems I can bear, cannot sit erect. He was not able to sit erect. He was a little bit bent. That's why I don't wear tight clothes. I feel bloated. I always prefer to wear loose clothes, especially around my waist. Gases are more in the afternoon, around 4-5 p.m. And then it stays there up to night. But yeah, around 4-5, my stomach is very full, completely bloated. And then he said, doctor, one more problem that he was a very thin subject. So he said, I can't eat sufficient food. And all my friends and family members tells me that, oh, why don't you eat something? You have to gain weight. So I don't have any specific tension as such, but so far I understand that my stomach gets full very easily. So, few mouthfuls is the rubric that they eat little bit and they're full. Like even if I like some food or dish, I feel like eating it thoroughly. But when I will start eating, I would just feel full. So shuru kiya, and within 5-10 minutes, he will feel that, oh, ho gaya, it's done. As soon as I eat 5-6 bites, I feel bas, that's all. Now I can't take it. I feel heaviness on the left side of the abdomen, and my memory is also not very good. I forget names, places. And then he said, I told him over phone that this is the place my clinic is located. And he said, I forgot your clinic place also. He called me at least 4 times to reach to my clinic. And then I said, okay, what do you like to eat? He said, sweets. I love sweets. And I eat everything as such, but sweets I really crave. So that's all. This was the case. So obviously, first I suggested the patient to do the sonography. We confirmed that it was a stone. And now again a statement. I wrote that we needed a remedy which can cure the renal stone with all his prominent symptoms like pain in the right side and the left side, flatulence which is aggravated in the afternoon and evening, backache which gets aggravated from sitting erect. He's, bending helps him, but sitting erect aggravates like anything. So I need the remedy which relieves the renal pain, removes the stone, and prevents the surgical intervention because it is stuck in the ureter. Can you suggest a remedy? Tell me. It is
Lycopodium.
Lycopodium, yes. So why so?
Midocaine, ma'am.
Yeah. So you are absolutely correct. It is lycopodium.
राइट साइडेड रेमेडी है और रेड सैंड
Yes.
इन यूरिन.
Yes. The red sand in urine. Very nice. Yes. So because this case you will see, our first case had a lot of mental symptoms. This case has a lot of physical symptoms and particular symptoms. That why earlier I chose clinical complete repertory, but this time we need a clinical repertory which has, a clinical confirmation of physical symptoms. So I chose Patak because Patak is a very good handy and small clinical repertory which has a lot of um, peculiar symptoms and also physical symptoms. So there are many general and some specific indications. Many generals and some specific indications are available. For this purpose, Patak is a great remedy, great repertory. I took peculiar symptoms of the case and tried them in Patak repertory. And for general symptoms, which, the gas which is happening in the evening, then I chose the complete also. So I did both ways repertorization in Patak and complete, and I took them together. So let's see. So in Patak repertory, I picked up this rubric Calculi. Calculi has only 21 remedies. What a relief! Because, and this is the beauty of Patak, that it has less number of remedies, but all are clinically tested, tried, and verified by Dr. Patak. Kidneys, urination after amelioration. This is a great rubric. It has only 2 remedies. I don't know the second one. One is Lyco, of course. But, he said only one thing relieves me is passing urine. बहुत कम, but it relieves me. So all these symptoms, peculiar symptoms are very important for our cases. Then he says abdomen distended, tympanic after meals. 3 remedies in Patak. And this is a great rubric which I just found, by the way, and I was so happy about that. What he said, whenever I go to my sister's place or any other place than my home, I will be constipated. So you can take this as a constipation traveling while, but if you listen to patient carefully, you will understand what symptom he is telling you. So constipation home, away from when. This rubric I did not get anywhere, only in Patak, and only single remedy rubric this is, lycopodium. Isn't it interesting? Constipation home, away from when.
Yes, it's very interesting, ma'am.
Yeah, I was very thrilled to see this when I saw.
Correct.
Abdomen pressure clothes of aggravation. He said, I don't wear the tight clothes. मुझे सहन ही नहीं होता. I always wear loose clothes. Appetite loathing after first bite. So पहले कुछ bites लेने के बाद ही he feels full. I could have taken few mouthfuls, but I have taken this because this is very specific, that even after first bite he feels loathing हो गया, बहुत full हो गया. Chronicity of complaints. See, generally, whenever renal stone happens, it's not that chronic. It doesn't stay for 2-3 months, and it's very rare. But in his case, it was there from 2 months. He was just bearing, and then suddenly it got acute. So that's why chronicity of complaints. Also, constipation is also chronic. So other complaints are also chronic. Back sitting aggravation, erect sitting aggravation. 3 remedies. And then abdomen affections in general, sides left. Left side is also paining. That's why I took this. And urine sediment red brick, like you said, that, red sediments. So like. And this I have taken from complete repertory because the general symptoms we cannot miss. If it is available, we should definitely try into repertory. So sweets desire, flatulence in the evening. We know that lipo is always aggravated in the evening between 4 to 8 p.m. and in the midnight, 12 a.m. afterwards. Flatulence afternoon 4 p.m. See, in complete also it has only 3 remedies. Yeah, very interesting. Flatulence, stool after. He said, whenever I pass stool, then also my abdomen is bloated. Distension in afternoon. And then he said, लोग मुझे बोलते तू खाता क्यों नहीं है? Why you are so thin? I took this rubric. Generalities, lean people. Generally, lycopodiums are lean, thin people. Appetite wanting, eating first bite after. Doctor, I want to eat, but I cannot. So appetite wanting after first bite. And satiety, easy. appetite, satiety, easing. So everything is covered by lycopodium. What a homeopath needs, nothing else. So I gave 1 ml 2 doses, BD for 2 days, and I said, let me know. So I called him after 2 days. He did not come. He came after 5 days. And he said, doctor, the pain went off in second days only. Second day ke baad hi pain was not there. Now no pain at all. Even after first dose, my pain was reduced by 50%. Second day only, I passed one small stone in the urine. He could see, okay, when the stone was passed. He said, I could feel that. I saw that. So he brought this stone. I have this stone still with me in my clinic. I'll show you. Also, doctor, my flatulence is much better. Just within 5 days, his flatulence was much better. And he said, I don't feel heavy in my stomach. Then I said, okay, I sell for 1 week and Lyco 1 ml whenever needed. After 1 week, let's meet again. In second follow-up, he had no pain. Stone also came out. He did a sonography. And there was only one small 2 or 3 mm stone remaining that was not there. And I found the stone during urination with little pain. I passed that. I brought that for you. And doctor, I forgot to tell you. So he forgot to tell me that he had the tendency of recurrent boils. He had a lot of recurrent boils in axilla and, otherwise also. So he said, I had one boil in my axilla last time when I came to you. But after your medicine, that also got subsided. And from last few days, I didn't have any boil. I thought to tell you this. And about my gas, it is much better. In last 2 weeks, only once I felt flatulence and distension. So nothing, no problem at all. And he said, मुझे नहीं पता था that homeopathy is so fast. Homeopathy can cure my stone. Actually, this patient is brought by his wife forcefully. She said, no, we have to take homeopathy. Otherwise, he was ready for the lithotripsy. So this is the status of 2020 wala case. Yeah. So you can see that in the first one, left side, you can see that there's this 13 mm stone. And on the right side, the second sonography has only 3 mm stone. Okay. Very reduced. Okay. So do you have any questions for this case? Or should we go ahead?
Did he continue to with the medication later on to clear out the 3 mm stone?
I gave him 2 doses and then I told him to do the sonography after 10-15 days, but he did not come back to me. So I don't know.
Okay, thank you.
Sometimes, patients when they are better and if the stone is passed and if they don't feel any pain, they don't come back to you. So that's the thing. I gave him and I wanted to try, I wanted to see that whether it gets passed or not, but he didn't come to me. So I don't know.
I guess he's better.
I guess so. Okay. So let's go to another. Yes, doctor.
Ma'am, do we use Berberis vulgaris in case of renal colic with our constitutional medicine?
In this case?
Yes, ma'am.
No. I'll tell you why. I do use that with the constitutional remedy. Many times I use. And that has beautiful results. But I did not use in this case because did you see everything is matching with lycopodium? Everything, not a single symptom which is not covered by lycopodium. So I was so sure that, he doesn't need any other aid. So sometimes I use Berberis, but I would prefer that in the left-sided renal stone. It was more of on the right side, so I will not use. I might use hydrangea to break large stones, but not in this case.
Okay.
So when you are absolutely sure of the remedy, then you know that it will, it will help the patient. Sometimes what happens that you get the case, but you don't get the full case. you prescribe the remedy, but still there is, little bit of either a doubt, or you just don't want the patient to suffer, then you can take help of mother tinctures or biochemics or anything else. That is okay. But in such cases, you don't need that. That is what I want to say. So I'm not against that, but you have to see which case needs it and which case doesn't. Okay. So again, one more case of renal stone only. I have a lot of renal stone cases somehow. So this is a case of 34 years male again. Renal stone in both the kidneys, 15 on the left side, multiple concretions, and intense pain, back pain. And you might have seen some, cases of renal stone. They have very bad pain. It's just intolerable. So patient says, I had pain in the abdomen 2 years back, and that was also very painful. So I went to the doctor, and he did emergency surgery because it was immense. So he was already undergone lithotripsy. Now again it has developed. I don't want to undergo the surgery again, doctor. Do something. Immense pain in the left side of abdomen, left hypochondrium and back. Please do something about my pain. He was almost crying. I don't want to do the surgery. I'm very frightened of this pain. When I go to urinate, tremendous pain happens. Also some blood comes out. So in this case also there is, this bleeding is happening. I feel intense pain along with some blood. I asked him, when does the pain occurs most? I said, before urination, during urination, after. So he said, during, I guess, during. Or I should say, when I stop urinating, in the last, in the end, when I stop. Huge pain, doctor. I cannot bear that. See, this is a very important question, I'll tell you. Whenever pain, you have to know the exact modality of the pain. This will, especially in renal stone cases, it will give you a absolute remedy. If you ask that what is the time of the pain, or what is the trigger, and what ameliorates it. Like in first case, we have very strong symptom that ameliorates by passing urine. Here, he gets pain while passing, and at the end, the pain increases. So this is our major symptom. So I said, okay, so pain happens when you stop at the end, right? Because I wanted to confirm my modality. So he said, yeah, in the end. I said, okay, tell me more about. So he said, some urine passes when I sit. I just feel embarrassed. So whenever I'm sitting, like that only, some drops will come out. And then he said, I have skin allergy also. It itches badly. And I saw on his legs and hands, there were some brown patches. Skin is very shriveled, dry. This is the observation. So in this case, we had only this much of data because patient was in terrible pain, terrible pain. And he was not able to tell me anything else. So would you like to suggest anything? Or would you like to tell me the rubric which you want to take? This is my analysis. What we want, renal stone of 15 with sand in the urine, tremendous pain when he closes urination. We need remedy for this, which also has some sort of skin allergy, but we don't have many symptoms of skin. Anything which you want to suggest?
So one thing is a rubric from complete repertory could be taken as pain, urination, close off at pressing towards genitals. I mean, you just see one remedy there, that's phosphoric acid. However, also because of the condition that the patient is in severe pain right now and you want a clearer image, you don't know anything more than what you see, Berberis vulgaris can be given at this time.
Yes, this is a great suggestion. The rubric which you mentioned is half part of rubric is absolutely applicable to the case, but this pressing genitals doesn't, it doesn't match us with the symptom. So, but yes, you're right that we can think about giving Berberis. Also, it is a left-sided stone, so no problem in giving that. So I went to repertory. I took. What did you ask? I couldn't hear. Sorry.
We can use boric repertory for this case.
Okay. Boric repertory, you're saying?
Yes, ma'am.
Yes, because it is a clinical repertory. We can use boric repertory for sure. I used
Because there are no much of symptoms, and there is skin and related with renal.
Right.
So, and with one modality.
Yes, absolutely correct. So we can definitely go to boric. Though I did not use boric repertory for no particular reason as such, but I use complete repertory very often because it is a big repertory. So by and large you get everything into it. So that's why I chose. I did not choose. I mean, it was a default setting maybe. So that's why I went into complete repertory. But yes, you're right. We can definitely think of boric repertory in such cases when you have less number of symptoms, or if you want to prescribe something purely on pathology, that is also fine because boric gives you directly that. So I took these rubrics: bladder calculi, urine with bloody because he has a lot of blood in the urine, pain calculi from in kidneys pain tearing intolerable as from passing calculus in back and hips. What he said, what pain hota hai piche whenever I'm passing. Then sediment, renal calculi, urine sediment, sand, gravel, small calculi, pain during urination. And this is the absolute rubric which we need: pain urination close of at. This is the most peculiar thing which we got in the case. Do you agree or not?
Yes, ma'am.
Yeah, at the closer.
Yes,
At the end.
closer.
So let's see. So is it visible? So the first remedy is sarsaparilla, the second is cantharus, then argentum, then lyco and pereira and everything. So we know what are the kidney remedies in this. Cantharus is one, but cantharus must have burning. So he did not have burning. That's why I left the cantharus there and then. Then we can think about Pereira breva also, but Pereira is not covering everything. It is only covering 4 symptoms. We have sarsaparilla and berberis also. If you could see on 5th or 6th number, berberis vulgaris is also there. So what I did is, because we did not have many symptoms here, I just went, read all these 4-5 remedies and then selected sarsaparilla. I'll tell you why. Because in sarsaparilla, this particular pain at the close of urination is very, very strong symptom. Okay. It is also a great renal remedy. And the main symptom of sarsaparilla is that when the urination ends, they have intolerable pain with blood in the urine. So I give sarsaparilla 1 ml 3 times a day for 3 days and check sarsaparilla and Fatak. Let's see. See, painful urination extorts screams worse at the close of urination. When they end, can pass urine only when standing. And he said no, that when I sit, urine dribbles. Some drops will come out. This is also covered by sarsa. So at night, urine flows freely. It dribbles while sitting. So when I saw this, I was very happy because it was covering one more symptom which was given by the patient. So I gave sarsa, and then in boric also you can see that urine scanty, slimy, flaky, sandy, gravel. He said, sand is there. Renal colic, severe pain at the conclusion of urination. When they conclude, urine dribbles while sitting. See, it is given in bold by boric. Bladder distended and tender. Child screams before and while passing urine. Sand on the diaper. Pain from right kidney downward. But it also has left-sided pain, okay? Tenesmus of bladder, urine passes in thin feeble stream. So after 2 days, stone came out in fragments. 2-3 fragments came out. Pain is not at all there. Feeling much better. He was saved by homeopathy from surgery. So after 1 month, pain, after 1 month also I did a follow-up. He said pain stopped within 2 days. Small stone came out recently, but very easily without any pain. And skin allergy also got better because sarsa is a remedy for skin as well. It is a very good remedy for brown spots on hands and itchiness. for eczema, dermatitis, all sort of skin issues. We always prescribe sarsa for skin, isn't it? So you can see. Can you see the stone in in the pouch? So we have kept it in the clinic on our wall. So this is a 15 stone, which came out, and he collected the stones. Okay, this is the USG. So on the left side, you can see that there is calculus, on the right side, no calculus. Okay, so that's all from my side. These are the cases. So what I want to convey is, whenever we are solving any case, you have to follow some basic things which will help you solve any sort of cases. So first thing which I have learned, and I still practice every day, try to practice, is careful listening. Careful listening of patient's narration. जितना हो सके कम interpret करो. No interpretation, or at least less interpretation, because sometimes we have to do that, but it has to be very, very less. We have to take exact symptom which patient is saying. When patient says that when I'm away from home, I'm constipated, we cannot take traveling aggravates. It is from away from home. It's just that we need to find out. So careful listening of patient's narration and then using it. Then writing down all the symptoms, it is very, very important. With location, sensation, modality concomitant. Whole LSMC, I guess I forgot to write C, but it has to be a complete symptom, because this will also help you a lot. Modalities are very, very important. Sometimes they just open up, they are like keys of the case. They would open up the remedy for you. Complete each symptom. Let the patient lead and you follow. This is a great learning which I have learned from different masters, especially Dr. Dinesh Chauhan and Dr. Shekhar, Dr. Shankaran, that it's not you who is asking the question or who needs to lead the case. It's his story, his life, his problem. Let him lead and you just follow. So be a follower in the case whenever patient is narrating. And then when you solve, then you become a leader. So that is part 2. Let the patient lead and you follow. Ask relevant questions. When patient is saying that, doctor, I have bad back pain, I cannot sit erect, don't ask, how's your sleep? Sleep is important, but this is an irrelevant question at the time. You have to ask more about back pain. Okay? Or tell me more about it. Is a better question than asking, what do you like to eat? Because you want to fill up that form. So don't do that. Ask relevant questions. Don't interfere or interrupt often. If you don't interrupt, patient will tell you. He will feel confused in the beginning, but slowly he'll get that, okay, ye bhi bata do, wo bhi bata do. And once he starts, you'll be surprised how much of information you will get from the patient. He's ready. Write down your questions and frame them well. If you write down, see, not only case, but we have to write down the questions also. This I have learned from Galathia sir and Dr. Shekhar. He always says that, you have to write down, you have to, he would, earlier he used to give us the transcript of the case, and I used to just read sir's questions, that what question he's asking. So we should be more interested in what question we should ask rather than what answer we are getting. We just focus on answers and not questions. Questions are very important. And when patient is done, then you ask whatever question you want to ask. But first, let him finish. So these are some rules of case taking which will really help you clinically. I feel so. This is my personal experience. And there are so many advantages of using repertory. So many people say that, repertory just confuses you. Repertory is not useful because if you know materia medica, final court of justice is only materia medica, and knowing keynotes is enough. But I would just want to tell you that what I feel, that our I feel that my memory is very limited. And as a human, our memory is not really good. Except masters like, Dr. Sarkar or other people who have really good command over materia medicas. So they are great people, but not all are same. So we have limited memory, and we know few symptoms of few remedies in homeopathy, not everything. So that's why repertory, comes into life to rescue you from this memory loss. And repertory helps you to become more unprejudiced, and it helps to prescribe remedies which we would never remember or never read even. I remember one of my case where I prescribed placenta as a remedy, where the child was not ready to sleep without parents, and he was a 7-8 years old child, and the mother said, "Ma'am, in last 7-8 years, his father did not travel anywhere for overnight. He has to go and come back in the same day because he won't sleep without both of us." And he was so attached to the parents, and I was clueless in this case. I just did simple repertorization, and I got this remedy, placenta, from repertory. I prescribed, and to my surprise, child started sleeping alone without parents. And because placenta is the remedy which is, which connects mother with the child, with the parent. He was so closely connected. He was so afraid of letting them go. So that helped. So that's why I said that, repertory helps you to prescribe some remedies which you might have never seen, heard. When I prescribed placenta, I never knew about this. But I just took took the chance because no other remedy was coming. So that helped me. So we can remember the symptoms and remedies through repertory. So it's a very good thing to use repertory often. Of course, don't do mechanical repertorization because that will also ruin your practice. But you have to use it very smartly and with skill. So learn every day, and then you will hone that skill. Our knowledge of materia medica, like I said, it is limited. So it limits the usage of medicine with our own limited knowledge. You would prescribe only bunch of remedies with your limited knowledge, and this won't be a very interesting practice then. Okay, so for example, I'll tell you one rubric which I saw. We know that calcarea carb has this profuse perspiration on head, and it is a sweaty remedy. It has sweat on the palms and everywhere. But if you go to this rubric, skin inability to perspire, it has calcarea carb. Inability to perspire. Similarly, in natramur, we know it is a remedy which craves salt. Okay, but if you go to desire of sweets desire for, you will see natramur there. Pulsatilla is there, and thirst, intense or thirsty remedies. Though we know it is a thirstless remedy. So that's how it just breaks your own fixed ideas. There are many clinical symptoms which otherwise we would never know if we don't use repertory. So this is also one thing which is an advantage of using repertory. And repertory is a bridge between materia medica and patient. You have to just match what is there in the patient with what is there in the repertory. That's all. It helps in case taking and make a practitioner unprejudiced. It helps you to ask better questions. If some remedy is coming in your repertory chart, you can frame questions accordingly. It also makes materia medica very interesting to study. And with gradation, we understand the importance of remedies in the same symptom. That what is the intensity of the same symptom in different remedies, or what is the relevance of that symptom in that remedy. So it helps understand the intensity of the symptom. And you can also study whole group or family with the help of repertory. So there are so many advantages of repertory. These are few which I feel are very helpful to me in my practice, and which could help you also. So that is what I want to tell all of you. Thank you so much for giving me this opportunity. I want to thank Dr. Ghansham sir and the whole team of ORTC for this wonderful opportunity where I shared whatever I know, whatever little bit I know. Thank you so much. If you have any questions, just let me know.
Thank you, Dr. Yamini.
Thank you. Thank you so much.
Thank you, ma'am, for such a wonderful session. For your
Thanks a lot.
Thank you so much.
Thank you.
Thank you.
Thank you very much.
Thank you. Do let me know your feedback or comments or questions in the group. Thank you so much, sir.
Yes, it was a great learning today.
Thank you. I'm so grateful to you.
Yes. Actually, not now, but since we started ORTC, I like the way you convey very easily, simply to participants. The technique is very good. So I like it so much.
Thank you. Thank you.
If anyone have any question, then you can share.